Since you're an expert in hair treatment, let's talk about that, because I'm finding this is a bigger and bigger topic, is treatments for hair loss lately, especially in women, which I associated when I was younger with men, right? Going bald, like the extreme of it. But then now I guess like after pregnancy, I've experienced hair loss and regrowth and the constant cycle. I told you because of my thyroid. It's like never ending I always have little babies all the time.
Me too.
And stuff.
Yeah. I have these little babies like after my baby.
Yeah, it's crazy. And then I find that like a lot of friends now, as we're in our 40s, they're all like, I'm getting thinner hair. So what would be, I know everyone's like minoxidil is like step one. Mm-hmm. What would you say?
Well, I think the step one is actually finding out why you're having hair loss.
Okay. I knew you were gonna say that. Okay.
Because there's like tons of reasons for it, of possible reasons for it. Interestingly, I find that most of my patients have a combination of reasons for it. So with almost everyone that comes in first, I do a scalp exam with my dermatoscope. Like I'm looking at your hair. I'm looking at the follicle. Is there scale around it? Is it inflamed? Is there scar? Is there no scar? Like there's so many different components of the hair itself that you may not recognize as someone who's just seeing hair is falling.
Right.
How many hairs are falling? When did it happen? Were there big stressors 3 months ago? Those are all, first of all, taken into consideration. Then I do a lab work for everyone. I check their thyroid.
Okay.
I check their iron levels. I check their vitamin D. And I check their like underlying hormone levels, like their DHEAS.
Oh, interesting.
Because I want to know why they're having the hair loss.
Wait, so vitamin D and iron play a factor into it also? Mm-hmm. And of course, those are the two things that I'm like the lowest in.
Yeah. I mean, you got to set yourself up for success.
Yeah.
So if like the inside of you is not balanced, then the outside of you is not balanced. That's why the skin and the hair tells the truth of something that's going on deeper a lot of times.
Right. That makes sense.
Okay. Let's say that it's bread and butter androgenetic alopecia, which is your hormonally, genetically associated hair loss, which is the most common form.
Okay. For men and women?
Yeah.
Okay.
So let's say it's that. Then typically, and I've done my lab workup and your labs are perfect. So then I like to start with either red light therapy at home, if someone can commit to like a 6 minutes a day kind of thing.
Yeah.
PRP injections. Actually, there's a new laser coming out that actually has come out that has been shown to increase hair growth.
Okay.
Super cool.
What's it called?
It's called the Folix laser, actually.
Do you have it?
I want to have it. So
okay.
It's brand new.
It's brand new.
Mm-hmm.
Okay. Exciting.
Yeah. And it's just a 30-minute treatment, and it increases. It's shown based on the studies that have been published so far to increase the hair growth.
Does it seem like it has downtime?
No. Ooh. No, I think it's honestly going to be such a big game changer. That's like my base.
First round.
Right?
Okay.
I like to then incorporate minoxidil, finasteride, and or spironolactone, depending on the person.
Okay.
So if you are a childbearing woman, these are not options for you right now because it's not safe for you. In the right person, it's a topical minoxidil or finasteride or an oral version of those medications.
Okay.
And then is like restoration surgery.
Okay.
Which I think is kind of underrated.
Like, is that hair transplant?
Yeah.
Okay.
Because you can even do something like change your hairline.
And actually, like now I'm at the age where I like guys I know are starting to get hair transplants. Yeah. So I'm seeing how it goes. It seemed really easy, actually. Like easy process considering like, you know, like plastic surgery. Like if you think about like a nose job that people are just like quick to do, right?
Yeah.
I see these guys get their hair transplants and I feel like they're in the office. I feel like it's a long process depending on how much they're transplanting. Right. But then the healing process compared to like the nose job, like they throw on a hat and they're good to go.
Exactly.
Yeah.
It's not that bad.
No. And then they're like, they've got like little follicles for a while and then it like kind of falls out. And then they've got hair.
And their life has changed. Because I think that a lot of and this is actually a reason I got into hair. I think a lot of your emotions are connected to your hair. Mm-hmm. I think we hold a lot of our emotions in our hair.
It's true.
And so, yeah, I like that. But something that's super important to tell people who are getting those hair restoration surgeries is that you should be doing medical management too. Because you don't want to, waste your investment that you just did.
And when you say medical management, you mean taking your
the rest of those things that I was talking about on that
on
that ladder. Like, are you doing your Rogaine? Are you doing your finasteride if that's the right person?
Yeah.
Are you keeping it up with your PRP injections?
Yeah.